morning, everyone. My name is Yasseen. Um, I'm from the Medical Partnership at the Medical College of Georgia. Me, along with my colleagues, Erik Rosas, Debbie Song, and Dr. Everett from Augusta University are excited to present our poster on socioeconomic factors pertaining to diabetic retinopathy. It's a pretty important public health issue, and we hope that this presentation can underscore some of the challenges that patients face due to systemic barriers and highlight some potential interventions. So just for some context, diabetic retinopathy affects about 9.6 million Americans, which is about a fourth of the diabetic population. And then about 1.8 million of those people have severe diabetic retinopathy that's vision threatening. We had a very interesting case that we came across of a 21-year-old female from rural Georgia. She was suffering from severe diabetic complications, including retinopathy. She had renal dysfunction, gastroparesis, and then unfortunately had osteomyelitis of the foot, ultimately resulting in amputations. When we went back in her charts and examined why exactly such a young patient had such severe systemic diabetic complications, we found some social determinants of health problems that may explain the severe systemic presentation at such a young age. So for example, one of those was financial barriers. The patient was repeatedly rescheduling her appointments due to the lack of insurance. She had inability to afford care. She had difficulty having people bring her places, and we believe that worsened her medical condition. She also cited lack of reliable transportation. She believes that contributed to her frequently missing appointments and delays, especially with something like diabetic retinopathy, where there's moments in time where patients should be ideally receiving interventions monthly. Even a delay by a week or two could have severe ocular effects on vision. When we were looking at her chart, we also saw that she had a relatively complex medical regimen. She had a lot of medications. She also had a history of medication noncompliance. So when we looked over her chart, we thought that that may have been affecting her overall willingness to adhere to just treatments. And then finally, just the fact that she was at such a young age dealing with these severe systemic issues, we believe that the mental health stress just from managing these comorbidities, along with the financial difficulties, may have affected her ability to adhere and be willing to adhere to her treatments. So we did a quick literature review just to see any possible treatments of any possible solutions for these issues. So one of them that was really interesting that we found was just with the technology in general advancing. There's a lot of potential things on the horizon that physicians may be able to incorporate into their clinics that may be able to help. For example, reminders for notification reminders, either through email, could be able to help. Additionally, there are some apps that can assist physicians in medication compliance. Um, and then additionally, there's new treatments such as gene therapy trials that are currently being done. So for these treatments, uh, the patient has a viron injected into the eye, and that viron goes into the cells and it attaches a piece of DNA into the cells, and it allows the medication, it allows the cell to essentially function as a factory producing the medication. So patients need less injections uh, overall. And we just thought it was an interesting. We know it's pretty early, but we thought it might be an interesting factor in the future as the technology advances, and it might be especially beneficial to patients that have difficulty making their appointments. And then additionally, we think that a bigger emphasis should be placed on the mental health aspect of patients facing these complications. We believe that that can improve patient outcomes in the long term. And so, in conclusion, our findings highlight just the progression to severe systemic diabetic retinopathy in an early age is significantly influenced by socioeconomic barriers, and we think that it's imperative to address the findings that we found here. And looking ahead, hopefully promising avenues such as gene therapy and other long-term treatment technologies could significantly improve the care for patients like the one discussed today.